As a professional in this department, you should know where the gas panels are located. There are 4 locations on the A-pod. Next to A5, across from T1 and T2, across from A9 and A10, next to the A-pod CT scanner, and the B-pod has 6 locations. There is 1 on each side of the B hall near the doctor's desk and the nurse's desk. The labels at the top tell you which panels control which rooms. Next to the F hall restroom, and behind the nurse's desk across from C22, affectionately known as the Facebook corner. In the corner between the doors to the waiting room from the B-pod and the blue pillow bin. On the wall between C22 and C23.
Vanessa, what would you do if the gas panel alarms were going off?
I would just totally call 911.
Just ignore it, like I do the monitors.
What gas panel?
This is Highland, right?
Vanessa, what would you do if the gas panel alarms were going off?
Well, the first thing I would do, I would notify the charge nurse and let them know, because they're the only ones that can shut off the gas valves. And then after that, they would contact the plant ops and they would take it from there.
Hey guys, we're talking about oxygen cylinders and their volumes and new terminology to say if they're full, unused, or used cylinders. First of all, full and unused cylinders in the green at 2000 psi. And so basically it's used if you've cracked the valve on a brand new cylinder, and it doesn't matter how much oxygen you've used, it's considered used and it goes into this cabinet. Alright, so it's totally fine to use a partially filled cylinder for your transport. Just don't run out of oxygen, number 1, but number 2, just make sure it's not stored over with the full cylinders. That's it.
I always label my blood tubes at the bedside.
You may be asked about labeling blood by a Joint Commissioner Surveyor. For safety and accuracy, the hospital policy is all samples are labeled at the patient's bedside.
Celebrate the wins.
That's right, Wes. When you were talking to a surveyor, celebrate our wins. Brag about all the great things we do in our department.
We work with world-class colleagues who treat us as equals.
And we have a great teamwork mentality.
We are the only level 1 trauma center in a 50,000 square mile area.
We have open communication with our leadership and a voice for change or improvement through unit board.
We provide excellent patient care daily and often at over 100% capacity.
We're super busy and we see every injury and illness.
We always make room for the next sick patient.
We treat a diverse patient population with an equally diverse staff.
And we have endless educational opportunities.
Are things perfect? No, but we do our best every day and we do have some things to celebrate.